Pulmonary function test is also called as PFTS, means lung function test. It is used to measure how your lungs are working, how we breathe in, we breathe out. It is very useful in a disease condition patient like asthma. It is of two types, static and dynamic. Let's see the definition. Pulmonary function tests are useful in assessing the functional status of the respiratory system, both under physiological and pathological conditions. It is based on the measurement of the volume of air breathed in or out during a normal or forced breathing. The instrument used for this is called spirometer. Pulmonary function tests are of two types, static pulmonary function test and dynamic. Static pulmonary function tests which measure the lung volume like tidal volume and vital capacity. Dynamic pulmonary function tests which measure the speed of airflow like force, vital capacity and FEV1. Static pulmonary function tests. These tests are based on the volume of air that flow in or out of the lung. They do not depend upon the rate of airflow. Static pulmonary function tests include the lung volume and lung capacity. First, we will see lung volume. There are four types of lung volume: tidal volume, inspiratory reserve volume, expiratory reserve volume, residual volume. Let's see one by one. Tidal volume. Tidal means total. It is defined as the volume of air inspired or expired during a single normal quiet respiration. It mainly signifies the depth of breathing. Normal value is 500 ml or zero point 0.5 liter. Inspiratory reserve volume. Inspiration means inhale, inspire in. It is defined as the additional volume of air that can be inspired forcefully after the end of normal inspiration. Normal value is 3300 ml, that is 3.3 liter. Expiratory reserve volume. Expiratory means exhale. It is the additional volume of air that can be expired forcefully after the end of the normal expiration. Normal value is 1000 ml or 1.0 liter. Residual volume. It is the volume of the air remaining in the lungs even after a maximal force of expiration. Normal value is 1200 ml or 1.2 liter. Let's see the lung capacity. Lung capacity are the combination of a two or more lung volume. There are four types: inspiratory capacity, vital capacity, functional residual capacity, total lung capacity. Inspiratory capacity is nothing but after you breathe out normally, then you take the deepest breath in possible. The total air you breathe in is your inspiratory capacity. It is defined as a maximum volume of air that can be inspired after a normal expiration. Here is formula: IC is equals to TV plus IRV. Inspiratory capacity is equals to tidal volume plus inspiratory reserve volume. Normal value is 500 plus 3300 is equals to 3800 ml, that is 3.8 liter. Vital capacity. When you take a really deep breath in, like you are about to blow up a big balloon, and then you breathe out as much air as you possible. That full amount of air you breathe in and out is called vital capacity. Let's see the definition. It is the maximum volume of air that can be expelled out forcefully after a deep inspiration. Example. Here is a formula: VC is equals to TVIRV plus ERV. VC vital capacity, TV tidal volume plus IRV inspiratory reserve volume plus ERV expiratory reserve volume. Normal value 500 plus 3300 plus 1000 is equals to 4800 ml, that is 4.8 liter. Functional residual capacity, nothing but it is the volume of air remaining in the lungs after a normal expiration. Here is formula: FRC is equals to ERV plus RV. That is, FRC means Functional residual capacity ERV, expiratory reserve volume plus RV, residual volume. Here is the normal value 1000 plus 1200 is equals to 2200 ml, that is 2.2 liter. Total lung capacity, it means all the air present in the lung completely full. Here is definition. It is the volume of air present in the lung after a deep inspiration. Maximum air in the lungs can hold. Formula TLC is equals to TV plus IRV plus ERV plus RV. TLC total lung capacity, TV tidal volume plus IRV inspiratory reserve volume plus ERV expiratory reserve volume plus RV residual volume. Normal value is 500 plus 3300 plus 1000 plus 1200 is equals to 6000 ml. That is 6 liter. Measurement of lung volume and lung capacity, we use a spirometer. Spirometer is used to measure lung volume and lung capacity on patients who are on ventilation. It records air in and out of the lung. Here is definition. Spirometry is a simple, non-invasive test used to measure lung volume and lung capacity, particularly those involved in ventilation. It records the movement of air into and out of the lung. Principle. It works on the principle of measuring the volume of air displaced by the movement of the chest and lung during inspiration and expiration. Instrument spirometer. A spirometer is an instrument used for performing spirometry. Here is the structure of spirometer. It is made up of metal or plastic and consists of two chamber, outer chamber and inner chamber. Outer chamber, the called as water chamber, filled with water. Inner chamber, inverted drum. An inverted bell dome immersed in water, open at the bottom, balanced by a counterweight. A mouthpiece is connected to the inner chamber through tube. When the subject breathes in or out, the inner chamber moves up or down. This movement is recorded as a spirogram graph on rotating drum or paper. Let's see the procedure of spirometer. A person places the mouthpiece in the mouth and nose closed by clip and breathe normally. During inspiration and expiration, the inverted drum moves up and down. The movement is recorded on a graph paper producing spirogram. Let's see parameter measured by spirometry. Tidal volume, inspiratory reserve volume, expiratory reserve volume, vital capacity, inspiratory capacity, functional residual capacity, dynamic measures. Dynamic pulmonary function test. These tests check how well and how fast your lungs can move in and out, like speed and strength of your breathing, not just how much air your lung can hold, but how quickly you can blow it out. Let's see, dynamic pulmonary function tests are based on the rate at which air is moved in and out of the lung. They mainly assess airway resistance and lung compliance. These include force vital capacity. It is the maximum volume of air that can be expelled out forcefully after a deep inspiration. Here's formula FVC, that is IRV plus TV plus ERV. It's important to measure and detect airway obstruction. Force expiratory volume. This tells us how much air you can forcefully blow out of your lung in a certain amount of a time. Force expiratory volume is nothing but it is the volume of air that can be forcefully expired in a given time after a deep inspiration. Here is subtype FEV1. Volume of air expired in a 1 second. FEV2. Volume of air expired in a 2 second. FEV3. Volume of air expired in 3 seconds. Clinical importance. The FEV1 by FVC ratio is normally about 80%. In obstructive lung disease, that is asthma and COPD, this ratio is decreased. Maximum voluntary ventilation is also called as maximum breathing capacity. It measures the greatest amount of air you can breathe in and out in 1 minute using fast and deep breath. Its normal value is 125 to 170 liters per minute in a healthy adult. Example, in hyperventilation, both the rate and force of respiration increase. Peak expiratory flow rate. It tells us how fast you can blow air out of your lungs. It is the maximum rate at which air can be expired after a deep inspiration. Its normal value is 400 liters per minute, varies with age, gender, height, and physical fitness. Clinical important. It is useful for assessing respiratory disease such as bronchial asthma. It helps in monitoring airway obstruction and treatment progress. Uses of spirometry. It is used to detect and classify lung disease. Obstructive lung disease. Example, asthma COPD. Obstructive lung disease. Example, pulmonary fibrosis. It is also used to monitor progress of respiratory disease and used to evaluate effectiveness of a therapy. Example, bronchodilator in asthma. Preoperative assessment of the lung and monitor the lung health in smoker and occupational exposure. Thank you.